This is Roger Green, host of the Surfing the MASH Tsunami podcast. This week, we are offering 5 conversations from episode 23, our discussion on challenges in physician-patient communication stemming from a session at the EASL Congress, with Louise Campbell, session co-chairs Shira, Zelber-Sagi, and Mike Betel, and panelists José, Willemse, and Tom Marjot. Plus, from the vault, a discussion from Shira's previous appearance on Surfing MASH in the U.S. Thanksgiving 2022 special. This episode's a bit unusual for 2 reasons. First, I'm not part of the conversation. Louise leads it brilliantly in my absence. Second, it focuses far more on the patient and the role of the physician-patient interaction in steering treatment. I found this fascinating and hope you do as well. This conversation has 2 elements. It starts with first-time surfers Tom Marjot and José Willemse introducing themselves to the listeners. After that, Shira starts by discussing the EASL Congress session within the context of a broader collaboration called EASL Patient Synergies. This program led to the creation of the Patient and Advocate Forum at the EASL Congress, of which this program is part. She said this year's program worked in developing, and I quote, very interesting and fruitful and open dialogue between patient and patient representatives and physicians, end of quote, focused on unmet patient needs and the role various providers can play in addressing them. Mike shares one of his key takeaways from the session, how fearful patients are when approaching physicians and how little information they share. In this context, Mike recalls a comment Tom made during the session that if a patient ever told him, and I quote, what you just said hurt me or made me feel bad, end of quote, that would have more impact on him than, as Tom puts it, an entire weekend at a stigma workshop. Tom describes 3 levels at which to address patient stigma. 2 of these, public policy and patient advocacy, are well known. But the third, improving direct physician-patient interaction, may be more vital and is underappreciated today. If patients provided direct feedback to Tom when Tom was communicating poorly, he says, he could adjust with the very next patient. Today, though, he doesn't get that kind of feedback. José sees this as a 2-way problem. Yes, most patients are fearful and do not share what they're thinking with the provider, but the reverse is true as well. When a patient shares feelings with the provider may not be equipped to handle it. She makes this point about provider insensitivity or failure to listen with 2 powerful personal vignettes. Tom recalls José telling him in Milano that when the physician turns off the computer screen, it changes the entire dialogue with the patient. He's begun to do so, and amazingly, it works. José makes a couple of points about this. First, simply asking the patient, how do you feel? And engaging with the answer makes the patient more satisfied with the visit. Second, this speaks to the idea that physicians do not realize how important they are in the lives of their patients. As I noted at the beginning of this introduction, this episode has a few things that make it really different. Focus on patients, me not being a part of it, and a really engaged panel that has diverse backgrounds. Conversation moves fast, covers a broad range of issues, so just sit back, listen, learn, absorb, and when you're done, join the conversation in our LinkedIn discussion group.
Tom Marjot.
So my name's Dr. Tom Marjot. I'm based at the University of Oxford in the UK. So I'm a clinician, I'm a clinical academic with kind of 2 hats on really. The first is very much as a day-to-day hepatology doctor, helping run a busy multidisciplinary MASLD clinic in a tertiary referral centre in the UK. And then the other 50% of my time is doing clinical research, mostly in metabolic disease and MASLD. And great to have contributed to the patient advocacy session at EASL Congress, and great to be invited back to talk about this a little bit further. And then now it's my time to reveal something to you. Is that right, Louise?
Louise Campbell.
Depends on what you're revealing.
Yeah. Let me just filter what's appropriate for the podcast. I like being center of attention. I think the best way to achieve that in day-to-day life is through karaoke. So I think it's quite difficult to get me off the karaoke stage from doing Elton John and Freddie Mercury and Billy Joel. I keep advocating at the various committees that I'm on. I think there should be more karaoke at hepatology conferences. Maybe that's something we can all lobby for going forward.
I think you've got an invite to a Japanese conference straight off.
Yeah, maybe I should go to a puzzle. You're right. But yeah, so that's me, and great to be here and looking forward to further discussion.
Fantastic. And José.
José Willemse.
Yeah, hi. Well, I'm happy to be here, and it's very exciting to meet Tom again because we had a wonderful session the first day of EASL. I am a patient advocate for over 25 years and the last 10 years in the liver world. And when I started, so in December 2013, they phoned me that I had the job as the CEO of the Dutch Liver Patient Association. I called one of my good friends, and he is a doctor. He's a professor now for people with diabetes, and he said to me, keep an eye on, at that time, NAFLD, because that's really a new kid on the block and it will be booming business in 10 years. So, well, now we're here. And I always did. And that was the time that Hep C was really in everybody's focus. But I don't know how it happened, but suddenly people asked me as a patient expert in all committees and groups for what we say now, steatotic liver disease. It's almost a hobby. And if it wasn't so serious. So I spent a lot of time with that. I'm retired now for 2 months, but the only thing that changed is that I can start every day now, like a Saturday, with coffee and a newspaper. And EASL keeps me busy and other groups because they say, well, now you have all the time in the world. Well, that's not true, but okay. And I have a guilty pleasure as well. I bring that every Congress with me, and that is I love to do some broderie. And I go with just the colors. And when it's finished, you have to throw it away. But a friend of mine said, give it to me, because she's an artist in wall carpets, the carpets for hanging on the wall. And she cut my products in pieces and made it there. So, and that's fine. And so, but nobody knows. This is really a secret, because nobody knows that I've always with me to relax a little bit and in the hotel room.
Let's get into it. So the topic for today did come out of the Patient and Advocate Forum, which was patient experience in the clinical settings, that was run by Michael and Shira. So Michael, Shira, bring us into where you started with this and just the general session, and then we can move on into discussing the real effects on patient challenges in healthcare.
Shira Zelber-Sagi.
So in Milan, in the last EASL conference, we had a fantastic patient and advocate forum discussing the patient experience in the clinical setting and unmet needs. And this is actually one of many activities that EASL is doing within the collaboration called EASL Patient Synergies. So a couple of years ago, EASL decided that he wants to work more closely with a patient organization, patient representatives. And we started to work on understanding better by working with the patient, trying to understand better their experience in clinical care, thinking about patient-reported outcomes, thinking about patients' quality of life, trying to better understand what are the needs of the patients from healthcare professionals, improving the dialogue between healthcare givers and patients, and of course, eventually together to promote the prevention and the better treatment of liver disease. So actually, the Patient and Advocate Forum is one of these activities that we're trying to do together. And this year, it really worked, I think, better than ever. And I think the reason is because we managed to develop a very interesting and fruitful and open dialogue between patient representatives and physicians, and really trying to understand what are the unmet needs of the patients and what are also the opportunities of physicians to improve the patient experience, the care that is given to the patients, the communication between the patients and the physician or the healthcare providers. And also, of course, we covered also many aspects of stigma and communication. And I think that these are the things that turned this session to be so interesting and successful. So I'm really happy to get the opportunity to further have these discussions with you today.
Mike Betel.
I will add to that, and thank you, Shira, that was a great summary, that it's so important for physicians, I'll start on that side of the equation, to understand what it's like for patients when they come in and how afraid they are. And I'm taking this away from the talk too, that for them to have the courage to share with the physician how they're really feeling, often they're not. And then because the physician is looked up to so much, they're either afraid to say something or they don't think they know enough to say anything, so they don't till they get home. So I have to give an example to start off. Maybe you can start off the discussion that way, because Shira talked about the stigma, and what I was left with out of the entire talk that I still remember, and I've told many people about already, is José was giving an example of being in the doctor's office. And then Tom, you said that if a patient actually said to you when they're having a discussion, their consultation, that what you said to them really hurt them or made them feel bad, you said you would learn more in that moment than you would learn an entire weekend at a stigma workshop. And to me, it was like, it blew my mind. I said, oh my God, that is so insightful.
Yeah, I felt the same, Mike, exactly. I remember this exact sentence, and it was so impressive.
Yeah, I'm glad that stuck with you, Mike. I really do mean it. Changing stigma and addressing stigma is kind of happens on 3 levels, I think. There's the kind of very top level public health thing, which is, about policy and government level policy and decriminalization of illicit drugs and branding of disease and nomenclature. And then there's the patient advocacy level, which is trying to collect patient voices and advocate strongly on behalf of them. But actually, I think the last level is the direct patient to doctor interaction that happens. And it can be so meaningful, and it allows you to change your practice absolutely immediately. So if you had a patient number 1 in clinic who said, actually, I'd prefer you to reframe the way you explain that in this way, or actually that terminology isn't quite as good, then patient number 2 comes along and I can immediately make a difference. So I think it's very powerful, but the barrier is allowing patients the time and freedom to voice that to their clinician, which I think people find hard. José, I don't know what you think. José, are you telling your doctor off very much?
No, yeah, and I think you're totally right. But the problem for the patient is that, well, they don't feel that free to say something against their doctor because it's their doctor. And despite all the theories we have that patients, are especially in the Netherlands, they know what to say and they don't feel shy to say, well, if it's concerning a doctor, they're afraid to ask the doctor what they really need or to say, hey, I'm not happy with that. And doctors are not used to those patients as well. I remember that I said to a doctor some years ago, you don't listen. And he said, yeah, I hear you. I said, yes, I see that, but you don't listen. That's something else. And he was really in shock. And I think that he will never forget that. But a lot of people don't dare to ask them, the doctors, like the examples I gave, had that because doctors are verbally very strong to patients. And I always gave the example that people don't feel, and this is what patients told me, because I always say, my job is very easy, I tell your stories. And they said, well, I didn't feel well, but I had the appointment and I thought, well, then the doctor will tell me what's going wrong with my liver because I really feel horrible. Came to the doctor and the doctor said, oh, well, I'm very satisfied. It's going well. Yeah, but doctor, I don't feel well. Oh, sorry to hear, but it's not your liver. And so the patient left the room completely frustrated and still feeling horrible. And instead of that doctor saying, hey, I don't think it's your liver, but let's see what can we do about it. Can tell me a little bit more. And it costs 1 minute extra.
I remember you saying, José, in coffee after the session, we had a catch up in coffee, and you told me you like it when the doctor turns off his computer screen in the clinic room and then adjust the whole body language. And that really stuck with me because I think in order to really address the problems of patients, you need to really focus and dedicate time within the consultation without distraction. The turning off the computer screen, one, doesn't distract the doctor, but also is kind of quite a nice signal that this is the patient's time. So I've started trying to do that, José, you'll be pleased to know.
Oh, wow. Oh, I'm really happy to do. No, I know a Dutch doctor who does that. He always say, well, we do first my part and then we go back to you. And so he said, oh, okay, now we are done. And, well, really put the screen away and say, well, tell me, how do you feel today? And that makes him very popular at the moment. But it's really so helpful because people really, you want that your doctor listen to you. Because I don't think our doctors realize how important they are in the life of patients. It's part of their life. You are depending on your doctor, and it's really a part of their life. And if your doctors, well, just send you away, because that's the feeling that patients very often have. And of course, they are good doctors. But this is really the main issue. The doctors are not aware how important their whole attitude is to a patient without saying anything.
And now, back to Roger.
We hope you've enjoyed this recording. If you have any comments or questions about the content of this conversation or the entire episode, please put them in the review section of the page from which you downloaded the conversation, or send an email to questions@surfingmesh.com. It's not clear what we're going to be doing next week. We're looking at approaches featuring NITs and a separate one focusing some basic science. Either way, I'm sure it'll be fascinating, and I can't wait for us to put it out for you next week. Until then, stay safe, surf on. We'll see you on podcast. Bye-bye now.